Hello and welcome to today's webinar. We're excited to have you here. Today we'll be discussing heart rate training zones. My name is Kayla Barrett. I'm a virtual fitness program coordinator with Premise Health. In this webinar, we will explore the different heart rate zones and how they can optimize your workouts. Whether you're a beginner or an experienced athlete, understanding these zones can greatly enhance your fitness journey. So let's dive in and discover the secrets behind heart rate training zones. We'll start with why it's important to keep track of your heart rate and why we're here today. Keeping track of your heart rate is crucial because it provides valuable insight into your cardiovascular health and fitness level. By monitoring your heart rate, you can determine the intensity of your workouts and ensure that you are working within the appropriate heart rate training zones for maximum efficiency and safety. Today, we'll explore the different heart rate zones and how they can help you optimize your fitness routine. The American Heart Association recommends a minimum of 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week for adults. Moderate intensity exercise can be classified as about 50 to 70% of your maximum heart rate, while vigorous intensity exercise would be classified as about 70 to 80% of your heart rate. So this is really important to know because when we set out to exercise for the week, it's important to know approximately how hard we should be working in order to meet these zones. If we aren't hitting 50 to 70% of our heart rate, the training is a little bit lower intensity and may not be giving us those benefits that we're looking for with that higher intensity heart rate. So now that we know how much we should be working out in order to meet the minimum recommended guidelines for adults, let's figure out how to determine our target heart rate zone. So we're looking for that 50 to 70% or the 70 to 80%. The most common way of determining heart rate max is by taking 220, just the number 220, and subtracting your age. So a 50-year-old individual would calculate their maximum heart rate as 170 beats per minute. So that's that 100% when we're looking at the percentage scale. This is more commonly used. It is a very quick and easy way to get a general maximum heart rate. However, if we want to get a little bit more specific, you have somebody who's been training a little bit more, what we can use is another option, which is called the Carvonen method. So with the difference being with this formula, it utilizes resting heart rate to determine a more personalized maximum heart rate. So it takes a little bit more math to determine this one. You're going to see we've got the max heart rate. We're subtracting the resting heart rate, or that's giving us our heart rate reserve. Then we are going to take that number and times it by our exercise intensity to get our heart rate. So a little bit more math involved, but you're actually going to see that we come up with a different number using this math. So we can go ahead and look down here. So we've got that 220 minus 50. So that gives us that 170, which is our max heart rate. And now we're subtracting that resting heart rate. So we're going to see with just the 220 minus age, we had a range of about 110 to 128. We were looking for that 65 to 70%. Whereas if we factor in the fact that this individual has a resting heart rate of 65, we're going to see that they actually have a little bit higher percentage. So we're looking at that 133 to 144. So this is taking into account that resting heart rate is generally lower with individuals who have more aerobic training. So we're getting a little higher heart rate percentage for that person because it's inferring that if they have a lower resting heart rate, that they're a little bit more highly trained. So when it comes to our heart rate, there are a few modes that can be used, as well as a lot of technology to help you track your heart rate. Just a few things to note when we're finding our heart rate is that you do have a pulse in your thumb. So we never use our thumb to track our heart rate accurately. And if you're looking for optimal accuracy, we find that the chest strap, when it's properly fitted, will be more accurate than your watch. However, using a watch will still provide a decent estimate to your heart rate. And then just make sure if we're ever using that carotid, which is on the neck, that we keep a low pressure. We never want to push down on our neck to take our pulse, especially if we are exercising, okay? But there are lots of ways to take that heart rate. We can do it on our wrist. There's an area on our bicep. A lot of people use the neck. Just be careful with that. And then, of course, technology can be a huge help in tracking that heart rate. Finding our resting heart rate is just a little bit more difficult in that there's not a lot of times in which we can take our resting heart rate. So the absolute best time to find our resting heart rate is the moment you wake up. Don't grab your phone, don't take a sip of water, don't go to the bathroom, don't do anything. You wake up and we take our pulse for 60 seconds. You count that pulse, and that is your resting heart rate. So typically for healthy adults, we're looking anywhere in that 55 to 85 beats per minute. However, this can be affected by stress, hormones, medication, anxiety, and activity levels. So, the night that you have stayed up late or, the week of a big presentation, those are not the weeks to find our resting heart rate. And then just note that medication can also play a factor, as well as genetics. My brother-in-law just has a resting heart rate in the 40s, which he is a runner, but I mean, everyone's heart rate is different. So it is nice to have that resting heart rate just kind of as a baseline for where we're at. So take that resting heart rate a few times and make sure it's times where we're at low stress and we've gotten a nice, good night of sleep, at least, 6 to 7 hours. So jump into heart rate zones. So again, we want to know these so we have a better understanding of what level we're training at. So let's go ahead and jump into zone 1. So zone 1, less than 57% of our max heart rate. This is our very easy, we're warming up, we can carry on our conversation. If you were to put this onto a scale, I would put this as a 1 or a 2. This might be stretching, light yoga. At this level, you could hold a full conversation without having any out of breath feelings. So very comfortable. A lot of people kind of use this zone as a recovery zone. Zone 2, here we're getting maybe into a walk or a slow jog. We're doing some more intense yoga. We can still hold a full conversation, and this feels like something we could sustain for at least an hour. We would probably classify this anywhere as a 3 or 4 out of 10. We've heard this zone also called the fat burn zone, but for weight loss or fat burn, you're going to get that from a calorie deficit. So the higher your heart rate, the more calories you burn. So there's really no reason to stay in this zone. This is another one of those zones. It's a good recovery zone. You're not pushing any of those optimal or difficult, challenging levels. So this is going to be one of our lower, easy, light to moderate zones. Zone 3. So things are starting to get a little spicy. You're reaching into the level of challenging. You're talking, but it's in shorter sentences with a little bit more breath. This is going to fall into your 5 or 6 out of 10. We're running, we're lifting really heavy. We might be doing some kickboxing, some Zumba, some cycling, some hiking. And we're going to classify this one harder just because we are pushing ourselves a little bit higher on that heart rate. You see, we're getting all the way up to that 76%. Heading into zone 4, this is where we're getting into our vigorous, uncomfortable, very hard and challenging zone. So when we are in this level, we're not holding a conversation. If we're talking, it's in short bursts or phrases. We've hit about a 7 or 8 out of 10. Training at this level is going to help us increase not only our aerobic fitness, but also our lactic threshold. So this is a really important zone because it's crucial for improving our overall athletic performance. So getting up into that higher rate, that's 7, 8 out of 10. This might be one of those training zones where it's in burst. We're not going to hang out here for an hour, most likely. This is something where we are doing a HIIT training and we get that heart rate nice and high. We take a recovery, we bring it back up, we recover, back. So this is one of those vigorous high intensities that we want to look for to increase our overall athletic performance. And then finally 5. So this is our maximal effort. This is the 9 or 10 out of 10. We can train at this level for probably short bursts. You're unable to speak or carry on our conversation. We're doing sprints. Maybe we're doing a burst of burpees or sprinting up a hill while cycling. But this is probably more into our athletic population and not a zone most people head into. So this would be described as very, very uncomfortable. So not really a zone we hang out in, but it is important to note just kind of in that sprinting maximal heart rate world. So a little bit of a disclaimer with these heart rates. So when I gave you the training zones, I gave you a few methods of determining the level in which you're training at. So when we're training, we are taking note not only of our heart rate, but also the level in which we're able to speak, how much we can talk to the person beside us, but also our perceived training level, which was that 1 out of 10 scale. Okay. So these are 3 things that we're thinking about the whole time we're training. Where's my heart rate at? how, am I able to talk? Can I hold a conversation? Am I completely out of breath? Am I, like wordless? And then how do I just feel? Does this feel like a 2 to me? Does this feel like an 8 to me? How do I feel that I'm pushing myself? So there are a variety of factors that can influence your heart rate. These include genetics, medications, stimulants, dehydration, medical conditions. So it's really important to listen to your body while you're training. If you're routinely exercising and you find that your heart rate is jumping really high, and even during your recovery, it's not coming down, it's an indicator of overtraining. So taking pre-workouts, taking stimulants, anything like that can affect your heart rate reaction. So you may be pushing your body harder than you realize. Additionally, if you're on any medications or you have any medical issues, please take the time to discuss with your physician how these factors may alter your heart rate or your reactions to exercise. So always follow medical guidance, use multiple factors when we're exercising to determine how we're feeling. Sometimes our body is just not feeling it that day. We have to recover. Maybe we overtrained, maybe we're undertraining. So listen to a variety of influences as we're exercising to make sure we're doing what's best for our body. Thank you so much for joining me today. I hope you're able to use this information as a resource in your fitness journey. In conclusion, monitoring your heart rate during exercise is crucial for understanding your body's response to physical activity. It's important to listen to your body and make adjustments to prevent overtraining and to ensure a safe and effective workout. Remember to consult with your healthcare provider for personalized advice based on your specific health conditions or medications, and have a wonderful day. Thank you so much. Please reach out if you have any questions.